We were 50th out of 50 states in the state of Texas at one point because of our approach for mental health care. And, that a statistic like that and the other things that I've learned, what I realized is that this is a real problem, and this is the time for us to get it together and have that conversation and do something about it. I am the founder of the Panhandle Behavioral Health Alliance. I'm a board member of the Meadows Mental Health Policy Institute and a nurse practitioner, physical therapist in my career. The Alliance is a neutral place for everyone who has anything to do with mental health and addiction to come together and have a conversation about how we approach those with those challenges and how do we approach treatment, because it's so fragmented.
So we are a community collaboration made up of providers, local leaders, and individuals and family members that come together to see how we can improve access to care in our community.
Meadows had a conference here in the beginning, so 6 years ago now, maybe 5 years ago, called Texas State of Mind, here in Amarillo, just to get us started on our conversation. And invited everyone who had anything to do with mental health care, including the justice system, the city of Amarillo, providers, city leaders. And it turned out to be true as to what we thought, and that is that everybody that has anything to do with mental health care and addiction is in a silo with their resources and what they do.
Well, one of the things that kept cropping up since the very beginning has been a need for individuals or for providers, whether it's the medical community or a service provider, to know who does what in terms of mental health and behavioral health in the community. So that led us to investing in the Panhandle Mental Health Guide. It's an online resource directory. You just type in panhandlementalhealthguide.org and it'll take you there. You can search by keyword or by categories and such. But the nice thing about it is that there's also a library of articles and videos that you can kind of research so that you can understand a little bit more about what's going on.
Two areas of focus for the Alliance are educating the community about prevention, early intervention, and available services, and addressing mental health care provider shortages.
We also do like a learning community for providers in terms of integrating behavioral health into primary care.
Someday, we would like to be where mental illness and addiction is treated like diabetes and heart disease.
Last but not least is our justice system population, because when we're not getting timely services and there's a huge stigma around reaching out for services, then you're ending up having altercations with the law or ending up in the jail, and your illness is being criminalized as opposed to being treated.
We know now from research that if we can intervene in mental health care and addiction early, we have a much better chance of taking care of it so that there's not problems later. So to me, the crisis is not taking care of those problems.